When people hear the term design thinking, many assume it has something to do with graphic design or product aesthetics. But design thinking is actually a problem solving approach that starts with one simple question: what does the user really need? Instead of jumping straight to solutions, design thinking encourages us to first understand people's experiences, challenges, and emotions. The process typically follows five steps: empathize, define, ideate, prototype, and test. Let's understand this with a simple example. Imagine a company wants to improve the experience of customers waiting at an airport. A traditional approach might focus on reducing waiting time. A design thinking approach would first observe travelers, talk to them, and understand what frustrates them. The company may discover that people don't mind waiting as much as they mind being uninformed. As a result, better communication and real time updates may solve the problem more effectively than simply trying to shorten queues. So, if design thinking is all about understanding people before creating solutions, where does it fit in an industry as scientific and research driven as pharmaceuticals? The answer is simple. Medicines are developed in laboratories, but they are used by real people living real lives. And that's where design thinking becomes incredibly valuable. Traditionally, pharmaceutical companies focused on developing medicines that effectively treated diseases. While that remains important, the industry has realized that even the best medicine won't deliver results if patients find it difficult to use, understand, or follow. This is where design thinking comes in. Let's take diabetes as an example. Many patients struggle with complex treatment routines. A design thinking approach would begin by observing patients, talking to them, and understanding their daily challenges. The company may discover that patients often forget doses, find devices intimidating, or struggle to understand instructions. So, based on these insights, teams generate ideas, build simple solutions, and test them with real users. This is why many pharmaceutical companies now offer easy to use insulin pens, medication reminder apps, and patient support platforms designed around actual patient needs rather than assumptions. A great real life example is the evolution of insulin delivery services. Earlier, insulin administration could be complicated and stressful. By studying patient behavior and gathering feedback, manufacturers redesigned insulin pens to be more convenient, portable, and user friendly. The result? Better patient confidence and improved treatment adherence. We saw another example during the COVID 19 pandemic when pharmaceutical organizations worked closely with healthcare professionals and patients to understand barriers to vaccine access and communication. These insights helped create more effective digital scheduling systems and patient engagement tools. The biggest lesson here is the innovation in healthcare is not only about discovering new drugs, it is also about designing better experiences for patients. And that's exactly what design thinking is all about: putting people at the center of every solution. Because in healthcare, understanding the patient is often the first step towards improving the outcome. Thank you very much.